So I thought I would share some healthy additions you can make to your life besides avoiding sugar and just eating nutrient-dense foods. I want to talk for a second about natural niacin, and I can back this up. So if you're worried about cholesterol, should I be on a statin? I don't want to have sudden heart failure or sudden cardiac death, or why are people dropping dead? Like, what can I do to keep my heart as healthy as possible? Well, you may or may not have heard there's a B vitamin called niacin, and it is naturally found in many, many foods. In fact, you can just Google what foods are high in niacin. You can even use AI like ChatGPT. Give me a food list of all the top 10 foods that are rich in niacin. I swear, AI, we need to embrace it because so far it is safe and it's super helpful to come up with little to-do lists. But I was going to review, and I promise this won't be boring. There was a study that they looked into. I don't want to name the product because I'm not trying to sell anything, but this product was a niacin product, and they wanted to prove that not only was it safe, but it reduced lipids, which are blood fats, which stick to the arteries and cause a whole bunch of problems, right? Like strokes, high blood pressure, inflammation, all the things we don't want. Oh, and also dementia. So they did find that this niacin treatment, again, I'm not gonna, there's lots of brands and names of niacins out there. My advice is, if you have a doctor or a healthcare practitioner that is educated in niacin, because you can take too much niacin. So I always say go low and slow. If you buy something over the counter at a health food store, and if it says to take 3 a day, how about just start with 1 a day and see how your body tolerates it? There is something called the niacin flush, when people take niacin and then they just get red all over and just feel really shaky and sweaty, and so that's called the niacin flush. And basically it's just opening the blood vessels at the surface of the skin. The blood pools up there, you get all red, you feel kind of warm, and then there's such a thing called no flush niacin. But anyway, in this study they wanted to show that niacin was effective and safe with patients with ischemic heart disease and hyperlipidemia, which is high blood fats. Especially when they were not able to tolerate prescription medications called fibrates. And they wanted to see if they could combine this with exercise, comparable to just throwing a patient on a prescription statin. So they found that yes, this particular niacin, now this one started at least 1,500 milligrams a day in this study. I'm not saying to take that much at all. In fact, that's kind of a high dose. But they showed that this decreased the LDL, which is the bad cholesterol, by 27%. And it increased HDL, which is the healthy cholesterol, by 17%. And it significantly improved overall the blood fats, the lipids, and the transfer proteins in patients with hyperlipidemia. It also improved lipid transfer with proteins like ApoA1 and ApoB. And again, these are more sensitive blood tests you can have done, like lipo-A and lipo-B, to see if those blood lipids are increased, because we want those lower as well. And so this was just great. That I just love it when there's a study, because I find, like with a lot of natural supplements and natural vitamins just found in nature and in healthy foods, there's not a lot of money to be made in that. So I always love when I come across a study that it's like, oh yes, this may be more effective in patients that cannot tolerate certain prescription medications. We could maybe talk to them about niacin. And again, you can just get that in natural foods. You don't even have to go out and buy niacin. So here's more specific scientific information. This type of niacin significantly improved the lipid profiles in patients with mild to moderate dyslipidemia, while inositol, or the flush-free niacin, which I talked about, didn't have the same effect. And it was even more beneficial in older patients with high blood fats. And I love that too, because I do get concerned on the elderly being on statins, because if they're not taking it correctly, for example, adding in CoQ10, mitigating the risk of the mitochondrial dysfunction because it pulls CoQ10 out of the cell and can lead to muscle cramping, fatigue, and pain and all that stuff. And that's why a lot of patients, they don't know why, but they stop statins because they said they just felt achy and sore all over and didn't know why. And there is a safer way of taking statins, but so there's that. Let's see what else. This also showed a twofold increase in the 24-hour urine metabolites versus prescription niacin. Wow. Okay, that was great, because there is prescription niacin, but this over-the-counter version showed a better effect with the metabolites. So basically, the ending sentence here is inexpensive and effective treatment for dyslipidemia, or high blood fats or high cholesterol. Isn't that good news? And so those of you, because I know the people that watch my channel, they're actually very educated and well-versed in health and nutrition. And I've been learning from you guys too, so I love when you comment. But isn't it good to know that just a B vitamin like niacin is great in reducing blood fats? I always say to patients, it's the triple threat: B vitamins, exercise, and fiber for reducing blood fats. And if that won't do it, and maybe there's a genetic predisposition to high blood fats, then we'll talk about prescriptions. But the nice thing about nature is God has created a wonderful planet, abundant, full of plants, fruits, and vegetables that can help heal us. So that's a scientific word about niacin, a B vitamin found abundant in certain grains and fruits. And so enjoy niacin, right? If you guys have anything to add to this, I would love to hear it. And again, generally speaking, if you take it in recommended doses, it should be fine. So that's a word about that. Hope you're having a great summer, and I'll see you on the next one.